Welcome back to the Madicles podcast, in which we discuss about disease prevention, health, and what humanity is through the lens of doctors working in various fields within medicine. The aim of this podcast is to provide practical information and tools for everyone on how to avoid diseases and conditions through the act of prevention, which is what medicine is all about, not just the healing process. Meanwhile, exploring insights into the views of doctors in various fields and how they believe they are changing their slice of the world. We are grateful to have with us Dr. Dimitrios Goulis, who is an OB-GYN/fertility expert and is also the very first doctor to be on our podcast. We'll be discussing infertility treatment between couples, the most common causes of infertility, and prevention. In the meantime, we'll also ask him about why he decided to focus specifically on fertility between couples and share some of his experiences being not only a doctor, but also a person with a passion for practicing medicine. If this episode helps you in any way or has left an impression on you, we encourage you to comment and share it with anyone who could benefit from it too. With that in mind, let's get right into it. Thank you for coming on the show with us. In your own words, who are you, what do you do, and what problems do you aim to solve?
I'm an OB-GYN guy. I'm a gynecologist and an expert on the infertile couples for infertility. What I'm aiming to solve, infertility. One thing is infertility, if we could do that. And the other thing is the prevention. What we said that we don't want to heal. We want to see only healthy people and not to see ill people that we are going to heal them. I think that this is our aim. This is not only my aim, this is medicine's aim. And the last 10, let's say 11 years, I'm working on that, I'm looking couples, not only women, the couple.
Okay.
And we're looking infertility issues.
Can I ask a question? Why does it matter to you, this problem, like personally?
Okay, this is a very good question. I have 2 kids. And I really quite understood how I did them. It was very easy for me. So I wanted for everybody to be the same. I don't know if you believe me, but this was my first aim, because as I did, and I have two very healthy children, I wanted the same for everyone. So this was the first click, let's say, to be an expert on that.
And why do you think this problem that you're trying to solve, why does it matter for other people who will be listening to this podcast, listening to you talking about what you do?
I think that there are 2 basic reasons. One of them is environment, what we call endocrine disruptors, environmental disruptors. Let's say it in an easy way, in a very simple way, that our lifestyle, what we eat, what we drink, what we smoke, how we live, and the environment. Yeah. And after that, it's the anxiety. Couples don't have normal sexual lives anymore. They're working the whole day, they have many things to solve, to think, many problems. So I think that these are the 2 basic things that we have infertility issues on the couples. The 2 basic things.
Getting a little more specific as to the patients, was there a case that you were ever very proud of treating?
Yes. We have a lot of cases like that, the things that you are asking. Difficult cases with infertility issues of both sides. And I think that they all have children now, and I'm very proud of it. We had a couple, I think 3 or 4 years ago, the male was 34 or 35, I don't exactly remember, but something like that. And 2 years, 2 years bigger was the female. So let's start from the female. It was with POF. It was a very early menopause. It was an ovarian insufficiency. So you know that they don't have the ovaries are not working.
Yes.
And she was, let's say, about 35 or 36, and in menopause. And the guy, we thought that he was azoospermatic.
Oh.
Yes. So we did for 2 years treatment to the female to, let's say, to do this restart on the ovaries. It was not easy because you have to use a lot of hormones. We did some very new treatment on the ovary with, let's say, we take blood from the sample, and we centrifuge. Yes, and we add some things, and then we inject it into the ovaries. This is something very new, very promising. And we did an FNA, so a fine needle aspiration, a biopsy with fine needle aspiration of the testicles on the male, and we found 3 not very mature spermatozoids, and we used them, and they have 2 couples from these 3
cases.
Yes, that we took from the testicle. I think this is one of the most serious cases. That
if you didn't tell me, I don't think I would know that it's possible to reverse the menopause.
Yeah, this is the first time we're hearing about something like this.
Yes, it is.
What is the prognosis? Like, what is the percentage of, let's say, reversing that? Is there a percentage of success rate?
The percentage is, I think it's not more than 15 or 17%.
Wow, and
So it was quite a rare case to actually go right.
Yes, we were lucky. You can say if it's luck, somebody can say it's God or karma. You can call it whatever you want, or all of them.
Yes.
But yes, it's not more than 15-17%.
And you are continuing to look into this to get the percentage to be higher in your research?
Yes. We did a lot of things. We're now running a protocol about POF and the procedure that I explained to you. Of course, it's very early to have a statistical data, but I think we need another 4 or 5 years, but it's good, it's promising. It's very good.
When people think about medicine in general, their minds usually go to cardiology, oncology, maybe neurology. How would you be able to convince maybe the general public that your field of studies?
Being an obstetrician, they think that you're a midwife, that you are not necessary to anyone, that everything happens automated and it's very easy. But in the other part, the gynecology, the last, let's say, 15 or 20 years, I think that it's one of the specialty medical specialties that they really grow up and really went a lot ahead, because all of that stuff with the IVF and the infertility issues that we managed to do, aside along with the endocrinology, actually we are doing people.
You mean like making people?
We make people, we do people.
Yes. It's actually, I think your specialty, in my opinion, as a let's say, very important role in how the world will look like in very far future.
Yes.
My reason is because we all know that the population now is aging.
Yes,
And
it is.
and people are not really willing to have kids anymore.
Yes.
Even myself,
Yes.
I always tell myself that I don't really want to have kids.
Why?
Maybe I haven't really formed an opinion, but up until now, my reason is because I don't see myself raising another version of myself.
You will not raise another version of you. You will raise the next generation, a better image of yourself.
Exactly. That's what I thought. Like that is how it's supposed to work. But I have a fear of, let's say, being failure in raising my own kids, because it's kind of like a bit of like my family background as well. So my mom and dad divorced, and now I'm with my mom. But like my dad is a good dad, but I've always been told from my mom that he's not, and that's what I fear the most. Is like, if I have my own kids, I'm afraid that I will be like my dad when I raise the kids. So that's
you will not be your parents. You will be the parents. So you can take advantage of what you saw in your whole life and turn it to something positive. Even the bad moments and the good moments, that's experience. Gain all the experience and turn it to something really good, really positive to your kids. It's challenging.
yeah.
It's not easy. It's not easy because you are not a parent. You are getting a parent as you pass your life. Actually, they don't come with manuals, kids, so that you can look at the manual and fix things. Okay. But this is very challenging, and I think that this keeps you alive. This gives you a lot of motivation.
Yeah.
A lot of motivation.
I was told that too, actually,
Yes.
by many people. They say that many of like mothers in Vietnam, I've heard that my kids are the only reason I live. They say that all the time
Yes.
to me.
Okay, let's say that is one of the basic, not the only one, because you have.
It was exaggerated, of course, I think.
Yes, but it's one of the basic things. Yes.
Okay, anyway, since we're talking about medical, from your everyday practice, like you told me, you see that the most common problem is the couple, they don't have sex as usual anymore.
Yes.
Can you tell me a bit more about it? Like, how is it possible?
It's not just having sex. It's having sex to having sex only. It's easy, but having kids, it's not easy because they are two different things. But first of all, I can tell you that as we see the data, every year the sexual lives of all the people, I don't say about Europe or Asia or for the whole world, they're having less sex. They're having the less sex, or if they have sex, they don't intend to do children.
Yeah,
This is an infertility issue too.
Really?
Yes. Because if I want to have only protected sex or to use any contraceptive method, it is an fertility issue.
What is the most common problem you see?
I think
Aside from that.
first of all, let's say that if we say that these are male and female factors, I think that taking data from the whole world, I think that it's 55% to male factors and 45% to female factors.
Okay.
But 20 years ago, it was totally
The other way around.
Yes. Yes. We think that the lifestyle and all the environmental issues affect much more males than females. That's the one part, the first part. The second part is that couples are not actually couples. Couple means, for me, that now I'm 49 years old, for me it means to be my person. Everything, my wife, my friend, my husband. It's different things, you know. It's not easy to connect them always. Okay, I may be an excellent father, but the worst husband. Or there are many things that we can say about that, but there are couples for just saying that they're couples or to just have sex. But that's not the reason.
Yeah, that's not the definition of a couple.
Okay, you can find sex if it's the sex the only thing you want. But we're talking about couples, so they're working a lot. Their anxiety is a very big problem for nowadays. If you work 10 or 11 hours, you don't think about sex when you go back home, okay? You press about yourself. There's a lot of pressure on young people, and they're trying to make them think that the whole life is that you must work. That's not the point of our life.
Even in Greece. Even in Greece,
you know what's the difference in Greece? That there's a lot of sun, a lot of sea, which is very, very helpful.
Yes.
And in a very strange way, until now, our families are getting involved in solving a lot of our problems. A lot.
So you mean the families intervene and there's not much independence for the younger people?
Yes. This is good and bad at the same time too. Okay. Very good because we had, let's say, a 10-year financial crisis. After that was the COVID crisis, let's say about that. It was, so the last 13, let's say 14 years, there were a lot of issues. Not only in Greece, I think in the whole world, okay? It was less in Greece because of these reasons.
I understand this quite a bit because as well with my mother, like I speak to her every day. I mean, I have been seeing a lot of people, especially in our class and around us, that are not Greek or not Mediterranean in this way, that say that, oh yeah, I haven't spoken to my parents in like a week.
Yes, yeah.
And to me it seems a bit weird sometimes, because I've grown up being around them quite a lot.
Yes, exactly.
That's exactly what I thought, because I see that the communication in Greece between the kids and the parents are like quite a lot. I didn't know that it would be a problem, especially in terms of intervening. I thought it would be like supportive, those kind of things.
It is supportive, but there's a time that you must cut the umbilical cord, okay? Not stop talking to your parents, but to cut the cord.
To be independent.
Yes.
A little bit more, yes.
Yeah.
What's happening here?
Okay.
You must find the balance in that. It's not easy, especially with the Greek mothers. It's not easy.
So back to the main problem that you said, it's the anxiety, it's the overworking.
Yes.
Do you think that this problem is overseen? Do you think people underestimate this problem?
Yes, they underestimated a lot, but let's say the last 2 or 3 years, it's you cannot underestimate it. You see it everywhere, believe me. I'm seeing couples that they haven't yet tried. And they say, we came to be tested to see what we can have. But I say, come on, enjoy the process. Okay, let's say for a year or so, but enjoy the process, be a couple.
Yes.
Before being a couple, to test you if you can do it. Test yourself so you can do it.
So they would come directly for IVF treatment?
That's anxiety.
Yeah.
Because I have a friend of mine, we always keep listening about that. I have a friend that he couldn't make, okay, it's your friend, it's not you. Try, and we will see. It's even better for us if we try. You know, we can take a lot of data. If you come and say that we tried for 1 year and you analyze all that trying,
Yes.
it's much better for us. But before trying,
That's a bit funny to me.
yes,
Never heard of something
that's
like this.
anxiety. I'm giving the easiest, the most simple example, but this is anxiety. Believe me, yes.
Wow. Okay. What is the most common state of the couples when they come to you for treatment? Like when they actually have a problem, how are they like to each other? Like, are they happy to each other? Are they mad? How is it usually?
You know, when they come to in front of you, I think that they're not very happy. And I'm trying to get them to understand that it's not my or your problem. It's not a male or a female problem. It's our thing. It's not even a problem. Because if you start accusing each other, that's up to you, then they divorce. Believe me.
Wow.
Yes. Or there's a lot of anxiety if I can't have a child, that I'm gonna lose you, my partner, my couple. Is very stressful, believe me.
Have you had a high rate of divorces? Like, you would treat a couple?
Yes, yes, I've seen a lot, yes. I've seen a lot. I think it rises every year.
And does that make you feel like you couldn't help them enough in that case?
No, even if they did children, too, they're getting divorced after that. You know, I actually believe that if as a couple I have problems with my wife, a kid won't solve that problem. It will intensify the problem.
Yeah, that's so true. That is so true.
Actually, they think that if we have a kid, we will see all the things in a different view and a different way.
Do you think the anxiety problem and the working long hour problem can be prevented somehow?
Yes, I think yes. One way is by preserving DNA or cells.
Tell me more about it, because I don't know anything about it.
It's the cryopreservation, so that we can take cells for males and females and preserve them. I mean about oocytes and sperm. You know, actually, there are two ages. The one is what your passport says, okay? The other one is the biological age. Our problem is the biological age always. In order not to be stressful about that, I'm getting old and I can't have children, it's very easy nowadays for both in the couple to preserve, let's say, sperm and oocytes. It's a very easy procedure. Very easy procedure.
Just out of curiosity, is it expensive? How much is it usually?
For keeping sperm, no. For keeping the oocytes, it's something about, let's say, the whole procedure, because it has an annual cost of 200 euros to preserve them. But first doing the procedure, it's something about 2,000 euros or something.
Could you
Once, you give that
Once,
once.
yeah.
Could you describe a bit about how you would actually get an oocyte? Because I can understand
How you can get
There is a protocol. It starts the second day of the menses, of the period. Actually, we give to the women about it's mini injections. We give FSH, this hormone. We're using that principle that when in our self we're giving a substance or a hormone or something that our self produces, the self production stops. So we give it in the way we want, okay? And it's a procedure that lasts, let's say, 12 to 15 days. We have some ultrasound done to see how the ovary reacts, because it's not something fixed. Let's say that for me it would have been 200 units, and for you it would have been 400 units, okay, daily. So we see with the ultrasound, we check how the ovary is reacting to that. And you give 2 blood samples to see the quality of the oocytes. And when the oocytes are, we measure at the ultrasound the number and the width of the oocytes, the size, let's say. And when all of them are about 2 centimeters, or if you prefer 20 millimeters, we arrange to do them, to take this oocyte, which is a very simple procedure with ultrasound again, and with a very fine needle. We give them to the laboratory to check them, and all these oocytes that they are in perfect condition, absolutely perfect. What the biologists say, it's AA to A. Yes, because it's not doing a cake, it's about doing a child, okay? So they must be perfect. Everything on this oocyte, we cryopreserve them.
Wow.
This is the whole procedure. It's very easy. It's not painful. It's not stressful. It's easy.
And you said for the male side, it's more expensive.
For the male, it's not expensive at all. It's let's say something about 200 euros the whole
per year.
Procedure. No, the whole procedure. And after that, it's about 20 or 30 euros annually.
Oh wow. Okay, that's much cheaper.
It's easier to also get out.
Yes. Okay. Anyway, so how many years have you been doing OB-GYN? Just
15. 14 now, it's the 15.
Wow. And what do you like the most about your job?
The love you get.
Like after
people, yes, the love you get, and it's not that you are a god or you feel like God, but you say that I helped a little bit in doing a new life, or bringing this new life to this world. It's a kind of magic.
Wow.
And you can't say that I got bored of it. I've done more than 7,000 births.
Wow.
Yes, and it's always like the first, believe me. Yes.
Out of curiosity, when did you decide that you were going to get into this field of medicine?
Excellent question. I was forced, I say it in a good way, I was forced to see my brother.
Giving birth?
Yes. I was 7 years old. My uncle was a gynecologist, and I knew that we were in the clinic and expect my mother to give birth to my brother, but he comes out suddenly and says, "Please come with me for a second, I want to tell you something, a secret." I was 7 years old. I said, "Okay," I gave him my hand and we're working together. And actually I was seated in front of a woman, I couldn't see the face, and I saw my brother being birthed, how can I say? Yes. And after that I understood, that was the test. He got the baby, he gave it to me. You say, oh, you kept it for 1 minute, you didn't drop it down. So I'm gonna give you a hug and I'm gonna make you an oxygen guy. I was so stressed. I think I couldn't sleep for a week or something.
You were 7 years old and somebody said that you're gonna, that you're gonna do this.
Yes. This was the first time that I realized that I kind of liked that thing.
And from
I always wanted to be a doctor, but I think that, let's say from the 15 or 16 years old when I said that I will be an oxygen guy.
And working in your field, have you ever had a case where it changed your approach to practicing?
Yes, change your approach or change you as
a person, as a medical doctor?
Yes, in many ways.
Mm-hmm.
Actually, one way is that you did a lot of good things to a person and he disappeared. He never say thank you. It changed me as a person because there were many times that you say that in a very stressful way that I can't help that woman anymore and something magical happens. I told you, you can say it in nature, you can say God, you can say karma, so you can name it whatever you want, but it's something that is bigger and stronger than you. Let's describe it like that. You say I'm till here, I can't help you anymore, and something magical happens. The next day, this person is in a
perfect condition.
Perfect condition. It's not you.
So could you go perhaps into detail about a specific case that made you go like, oh, okay?
Yes, it was I have many to say, but I can say about one that it was a very young lady giving birth. There were many complications because there were many pathological issues with her health, and there was a very abnormal postpartum bleeding. Postpartum.
That's so scary.
Yes, this is scary. This is our biggest problem always. Yeah. It's not in the process, it's the postpartum. Actually, we gave her 19 units of blood. And I thought that he wouldn't make it. And I stood there with her, let's say about 17 or 18 hours in the emergency unit, and she woke up. I don't know how she woke up, and he saw me standing like that. He said, "What are you doing here next to me? Please go home, see your children, I'm fine." I thought she was dead.
Wow.
After 18, I haven't slept, I haven't ate, I haven't done nothing. There was 18 or 19 hours by her. She woke up and she hugged me and said, "What are you doing here with me? I'm fine. Go see yourself how ugly you look." I said, "Are you kidding? You were dead." I said, No, you look like dead. I'm fine." And she was fine. That's what I told you before, that it was not me. It's something
else.
It must be a very magical moment.
Yes.
That was.
Yes.
So you told me that there are many cases, like you said, that you told the patient that there's nothing more you can do, and then suddenly something happened. I'm curious, how many percent, let's say, of your job is to tell people bad news?
Oh, especially in my job, it's, let's say, 2 or 3%. Even, no, maybe not that much, even less.
I would have expected it to be a bit higher.
Yeah, because I thought you would tell people, "Oh, you have this, oh, you have that," like almost every day.
Look, as an obstetrician, you don't have many often to say bad news. It's it's not often, and that's good. As a gynecologist, yes, you see a lot of things, but it's not actually more than 3 or 4%.
Okay, that's good. Maybe
That's good.
It's much better.
Yes. Was there ever any case that there's nothing more you could do, and there's no magical moment?
In my career, in this life, no, for me.
So there was always something you could do.
Yes, someone, not only me, someone.
Wow.
Yes.
Okay.
I didn't have until now such a case. Yes.
Okay, that's cool. That's actually very good.
That's very
Anyway, so to finish this podcast, we have a closing tradition. Since you are like the first doctor, you're not going to be answering to something, but since you're the first doctor, our closing tradition is that we want to ask you to give us some kind of like challenge, not exactly challenge, but a problem or a opportunity that you see in your field that you would like us to, let's say, see more into it, or you just see potential, or you see big problem that we will also talk about with the next doctor, and we would like you to write it down here. Yeah, like something that you could think of.